And welcome into Getting Help from Uncle Sam or To Your Health. It could be two different things because this is a state department, but it's also giving you good health advice. It's the Alabama Department of Mental Health, and today we have with us the Commissioner, Kim Boswell. Glad to have you back again. And Kim, the department it's a pretty good sized department, isn't it?
It is.
Because you've got a lot of things under your purview there.
We do. We offer services to individuals with intellectual and developmental disabilities, and then we also offer services for individuals who have mental health needs and substance use disorder needs.
Mm-hmm. And we've been hearing that there's probably not enough outlets to treat people with mental illness, but you're addressing that right now. There's centers opening up as we speak around this state.
Certainly, we're so excited about the crisis centers that we've been able to open around the state. We currently have 3 that are operating in our state in Mobile, Montgomery, thankfully,
yes,
and in Huntsville. And then Jefferson County also has a crisis center that is opening this month.
Oh, wow.
And then we have 2 more that are coming in Dothan and Tuscaloosa this next year. So those crisis centers really provide a critical service at the immediate time that someone is in a behavioral health crisis.
Mm-hmm.
So 24/7, 365 days a year. We used to run a system where it was very hard to get in our system.
Yes.
And, if you were in a crisis, we would put you on a waiting list. And obviously that doesn't work well.
You don't call the suicide hotline, get put on
Right,
hold.
right,
so
exactly.
Yes,
That's
yes.
kind of how we were operating. And, we went through years of proration and budget cuts.
Mm-hmm.
And so thankfully, over the last 4 years, really, the legislature has provided us funding to develop these crisis services across the state so that when people are in a behavioral health crisis, they have somewhere to go.
Mm-hmm. It's basically because obviously when it happens, you want help as quickly as you can get it.
Right.
And when you're talking about strategically across the state, that doesn't mean you have to live in Huntsville. It's 5 counties surrounding Huntsville.
Correct.
It's 5 counties surrounding Montgomery, where it's easy to get to those. So you're actually right now, as you sit, you're probably covering about 2/3 of the state.
Right.
And when you consider those counties, so you're in the right direction.
Thank you.
And
we do think we need more crisis centers. We hope to get to 11.
Yeah, and basically, if you nip it in the bud, and that's why I say this doing is nipping it in the bud. Right now in the state of Alabama, we're probably short people that are in the mental health field by quite a few people, right?
Absolutely. I did my budget presentation yesterday, and everything was about workforce. I mean, that was really the message. Is the biggest challenge we have right now is we have this demand for services, but we don't have the mental health professionals to provide it. And so a big part of our budget request this year is really a combination of strategies. There are wage strategies. As I mentioned, we used to run long waiting lists, and then we also paid very low wages. And so we went into COVID and the workforce crisis really pretty far behind. And so a big part of what we're doing this year is asking the legislature to fund some wage strategies that will help our community providers be able to compete and be able to retain employees instead of them going other places where they can make a whole lot more money than they can in the mental health system. But we do have an actual shortage. Even before COVID in Alabama, it was 1 mental health professional to 1,260 people.
Ooh.
So, we weren't in good shape before COVID. And so now
then
we're in worse shape.
More, yeah.
Yes.
It's crazy. Well, we're very blessed in the state of Alabama to have a lot of reservists and Guard and also veterans.
Yes.
It seems like Alabama's where veterans here's where I'm going to hang up my boots and
Right.
Put my backpack over here. But again, a lot of these veterans are suffering from mental health problems also. I know through the Alabama Department of Veterans Affairs, they try to address some of that, but basically it falls into your lap too, doesn't it?
It absolutely does. We have a great partnership with Department of Veterans Affairs. We, of course, are very concerned about the suicide rate among veterans in Alabama because it's very high. And one of the partnerships that we've had with them is around 988. So And July 16th.
And that, for your 988 is a suicide hotline. You don't have to, what am I, just remember 988 and you're connected with somebody 24/7, right?
24/7.
Yes.
That conversion from the National Suicide Hotline 10-digit number happened July 16th of 2020. And so we're very excited. We've received over 1,900 calls, and we had a really close partnership and a media campaign with Department of Veterans Affairs so that we could get the word out to veterans as well as other individuals that you don't have to figure out how to navigate the mental health system. Just pick up the phone and call 988, and the person on the other end of the line can help you navigate the system, help you figure out where you can go to get help.
Well, thank you so much for these
Sure.
past 3 weeks of wonderful interviews. And just remember, it's a department here that's here to serve you, one of the premier departments in the state of Alabama. We'll be right back right after this.